One of the things that struck me so much about Jack and Maggie is their overwhelming passion for the cause. They obviously have a personal commitment to educating people, and they're so dedicated in the work that they do. They're working tirelessly. They've really grown significantly. They've taken they've gone from very small beginnings, and now they're out there. I see Mollies Fund all over the place, and it's so fantastic.
Thanks to your continued support, 2013 has been another productive year. Because of your help, we have been able to expand our public awareness campaigns. Our taxi public service announcements have educated millions of New Yorkers and tourists. Our television public service announcements have been aired on all the major networks.
My sister Molly was just 20 years old when she died from melanoma. She had a small mole in the back of her leg that was left unchecked. Regardless of your skin tone, if you have a mole that changes shape or color, see a dermatologist right away.
Download this free app today to learn about mole identification and how to stay skin cancer safe.
Skin cancer is preventable, and melanoma, if caught early, can be cured.
Besides the Long Island Railroad, we were able to expand our in-car posters to the Metro North line. Now riders from Westchester and Connecticut will learn about the value of being sun-safe. Posters on the exterior of buses that travel from Orient to East Hampton remind the public on both the North Fork and South Fork about sun protection. Once again, we teamed up with Yankee Radio for weekend home game public service announcements that remind fans to be sun-safe.
Hey fans, the Yankees are heading out under the sun today. The Molly Begain Melanoma Foundation wants to remind you that when you head out to protect yourself, seek shade and wear sunglasses and protective clothing.
Cat's Corner is a Sunday 7 a.m. call-in radio show broadcast on 770 WABC. The show is dedicated to giving listeners straight talk on medical conditions. It's hosted by Dr. Aaron Katz, Chairman of Urology at Winthrop University Hospital, and co-hosted by Dr. Philippa Cheatham.
We have over 100,000 loyal listeners every Sunday. They're using the Mollies Fund to get the message out. And we know that prevention obviously is so much better than cure. And if you are diagnosed with melanoma, obviously the earlier that we detect it, the better the outcome.
Jack and Maggie were featured guests on their December 16th radio program with Dr. Maggie Callahan of Memorial Sloan Kettering.
The important thing is to reapply, and
nothing less than a 30.
Nothing less than a 30.
And will I get a tan if I use a 30 or higher? I mean, because of course I want to come back to New York and have a little color, right? That's
Aaron, go for a spray tan.
Spray tan?
The only safe tan is a spray tan.
You ever do that, Philippa?
I'm not going to tell you all my secrets on air.
We were honored to be invited to participate in Bristol Myers Squibb's Melanoma Advocate Advisory Meeting in Princeton, New Jersey. It was an opportunity for us to meet other leaders in the melanoma community and learn about successful initiatives. Mollies Fund was privileged to be named the presidential charity of the New York State Society of Physician Assistants for the 2013-2014 year. The Federal Bureau of Labor Statistics lists physician assistants as one of the top 10 growth professions in the United States.
So there are over 11,000 practicing PAs in New York State in every discipline, every area of medicine, urgent care facilities, primary care practices, ICUs, the gamut. They have the opportunity through this educational initiative to screen patients for melanoma when they're evaluating them or admitting them to a hospital. Moving forward, the other opportunity that this presents for Mollies Fund is that New York State sponsors the most number of PA programs in the country. We are the biggest producer and the biggest exporter of PAs. There's opportunity for Mollies Fund and NISPA to reach out to the PA programs in New York State to make melanoma education a mandatory part of the curriculum, very similar to what Mollies Fund did at the middle school education level.
This summer, we were able to grow our Lunch and Learn About Melanoma Nursing initiative. Our presenter, Victoria Siegel, Associate Professor of Nursing at Molloy College, reminded nurses about their responsibility to educate patients about skin care and melanoma.
Today we're going to go over what some problematic moles could look like. If you saw something like that on a patient, would you be able to say to them, I think we need to show your doctor this mole?
In a 30-year career, hospital nurses care for an average of 35,000 patients. Dr. Siegel's aim is to take advantage of this ideal platform to educate and to inform.
They do skin assessments on their patients every day, and this is just another piece of information that they can impart to their patients that they see as they're doing their routine work. It was excellent, it was informative, and it was very helpful for the nursing staff to come and learn in a very enjoyable environment.
In July of 2013, the Hoag One Unit Council was honored to have the foundation come to Winthrop University Hospital and host an event to discuss skin cancer and melanoma to the nursing staff at Winthrop. The seminar gave the nursing staff the information that they can use readily to educate their patients and their families.
We had about 60 people in attendance. That included nursing students who were interning in the summer, and we had registered nurses who were in orientation. We had nurses from the hospital, educators, so we had a good turnout. After the presentation was over, everyone stayed after to speak with Mr. and Mrs. Begain and also Dr. Siegel. They were hungry for more information, and they did approach me afterwards to tell me what a great idea it was, and they learned a lot.
It was a highly successful event, and we would love for the foundation to come back next year and help promote the message.
We are here today at NYU. This is our 5th year collaborating with Jack and Maggie from Mollies Fund on the annual Skin Cancer Awareness Program. Today we have with us Dr. Elizabeth Hale, Dr. Russell Berman, Dr. Anna Pavlik, and Deborah Coppell. People look forward to this program. I get calls all throughout the year. When are you doing talks on skin cancer awareness? Every year we get great feedback on the program. I would like to give a special thank you to Jack and Maggie from Mollies Fund who are collaborating with us today. It's always a pleasure working with them, and they do so much important work.
Mollies Fund initiatives and growth with young adults is increasing. Our programs with colleges and universities have been very rewarding because so many were student-directed.
Today we're having a sun safety event, so we're trying to educate the students at Adelphi a little bit on how to be safer during spring break. We're going to be talking a little bit about how to be safe on campus. We're doing it in conjunction with Mollies Fund.
Reapply sunscreen during the day and follow directions as followed on the bottle.
These ambassadors were able to organize their own venues to educate their fellow students about melanoma prevention. The Junior Board has made terrific suggestions for technological improvements. The Mollies Fund website is now designed to accommodate smartphones and tablets, and it's easier to navigate. We have also added the ZocDoc widget to our homepage, which allows users to enter their zip code and to find a nearby board-certified dermatologist, along with their insurance options and reviews. On September 7th, the Junior Board participated in the legendary Yankee Fan Fest on the docks of the Intrepid. We interacted with enthusiastic Yankee fans, passing out sunscreen and educational materials.
We decided as a board that we needed to make the Mollies Fund materials more accessible to a younger audience. We've effectively done this by enhancing our applications and our website. When we get together, a lot of interesting ideas are being introduced, and this year our focus was on social media.
The Be Shady initiative, another creation of our Junior Board, encourages sharing sun-smart photos with us to inspire others to be sun-safe. Don't forget to post your pictures to our Facebook wall and Twitter page using the hashtag #BeShadyAtMolliesFund.
We're expecting you to be the ambassadors, and this time we're giving you permission to tell a grown-up what to do.
I look forward to the day when kids say, "Mom, Dad, you're going out without your sunscreen. We learned in school that's bad."
With the assistance of Dr. Ted Daly and Dr. John Clark, the Garden City Middle School 6th graders learned about skin cancer prevention and the importance of being sun-safe. Mollies Fund continues to provide hats, sunscreen, and educational materials to the Garden City Pool and other local events like the Jay Gallagher Lacrosse Tournament.
The foundation's meant a lot to myself and a few other people. I had a melanoma on my leg, and I think I even paid attention to my skin because of the Molly Foundation. I definitely would like to thank Jack, Maggie, his entire family.
Thank you again for the support of both our boards. We truly appreciate their commitment and ideas for helping us grow. A special thank you to MCS Advertising. Their creativity has helped us advance our message through our public service efforts. We also want to credit Jeffrey & Foster Incorporated. Because of their printing support over the past 13 years, we have been able to circulate hundreds of thousands of Have You Checked Your Skin Lately and Protect Your Baby from the Sun brochures. Once again, in Molly's name, we thank you for all your interest and continued support.